Hello viewers, you welcome to my YouTube channel once again. Today's video will be talking about shock. The four different types of shock. What are the four different types of shocks? How do we differentiate between this particular type of shock from this particular type of shock? So shock, before we go into the types of shock is when the vital organs are receiving low blood supply. So when the vital organs are receiving the low blood supply, you should know that shock is coming up. So what are now the four different types of shock? First of all, we have before I also go further to the different type of shocks, we have shocks to be described in simply in this manner as the systemic low of blood pressure. When there is massive vasodilations of the blood vessels, then shock tends to occur, and therefore there will also be systemic low of blood pressure when there is systemic vasodilations. Vasodilation simply means increase in the tensile strength, increase in the lumen of the blood vessels. So number one of this type of shocks is cardiogenic shock. Cardiogenic shocks is basically talking about dealing with the heart. When the heart stops to function, to perform the works that it's supposed to do, we know the heart do the work of contracting and relaxing, thereby pumping blood into the systemic into the general circulations, being systemic and circulatory systems. So the heart does the function of pumping blood into the general body for its effective use. So when there is a problem with the heart, then cardiogenic shocks tends to happen. Then the heart is divided into four chambers: the atriums and the atria and the ventricles. So the atria, the right and the left atria, then the ventricles, the right and the left ventricles. So when the ventricles fails to perform its functions of pumping blood effectively through the blood vessels into the general systems, then cardiogenic shocks tends to occur. So what could cause this? It could happen in the case of myocardial infarction. When there is a patient that is suffering from myocardial infarction, you could see cardiogenic shocks manifesting in this case. Cardiogenic shocks simply means the heart fails to pump blood into the systems. And when the heart fails to pump blood into the systems, then you're going to be witnessing cardiogenic shock. There will be low blood volume. In this case, there is no vasodilations that we're talking about, but the thing is, the pumping machine, which is the heart, is failing to pump blood into the general system for its effective use. Then the number two of the type of shocks is septic shock. Septic shock. Sepsis means infection. So and when there is massive infections that is leading to vasodilation of blood vessels, then we say septic shocks is bound to occur. For instance, in pneumonia, the infection or the infestations of the lungs with bacteria, and these could result into the bacteria mixing with the blood and blood flows entering into the general systems, and the massive infestations of these bacteria into the bloodstreams could cause the vasodilations of the blood vessels, low blood pressure, thereby reducing the intravascular volumes of the blood vessels. Then we have septic shock. It occurs when there is massive infection, bacterial infection, viral infections into the bloodstreams. Then these septic shocks is bound to occur. Then the number three on my list is hypovolemic shock. Hypovolemic shock. From the word hypo means low, hyper means high. So hypovolemic shocks, low blood volume, simply means low blood volume. And this happens when there is depletion in the intravascular volume. When the intravascular volume is depleted, then we plan to have hypovolemic shocks. And this happens when there is a RTA, road traffic accidents, and there is an hemorrhagic shock. It is there is breakage in the continuity of the skin, and we could see that excuse me, there's breakage in the continuity of the skins and there is massive blood loss. Then hypovolemic shocks is going to happen, which will result into dehydration. Another things that can result into dehydration is prolonged uncontrolled vomiting and stooling, whereby there is excessive loss of blood volumes, blood fluids, and electrolytes. This could result into hypovolemic shock. Number 4, anaphylactic shock. Lastly, anaphylactic shocks. This is due to exposure to allergens. And it triggers the antigen antibody reaction. This triggers the antigen antibody reactions. You could have allergens like pollens, insects, sting, bites, and so on and so forth. It could even be chemical substances. So this could trigger the antibody antigen reactions. So this could result into anaphylactic shock. Anaphylactic shocks is a reactional shock to an antigens, to a foreign body. So anaphylactic shocks could happen in this case. Anaphylactic shocks can also happen in case of transplants, whereby the organs in the body refuse to accept the organs being transplanted. So anaphylactic reactions between antigen antibody reactions, thereby releasing some chemical mediators that could trigger the anaphylaxis process. So this is the 4 types of shocks that you need to know. And if you enjoyed this video, please don't forget to like this video, comment in the section below if you have any further questions or contributions you want to share to these topics, and don't forget to subscribe to my YouTube channel. Thank you so much, and I see you in the next video. Bye.